Dr. Jeff here with you again this week. I get patients coming in actually quite often. They'll come in and they have a shoulder pain or a back pain or knee pain and say, I think I need an MRI. So I thought we'd talk a little bit today of X-rays and ultrasounds, MRIs, and CAT scans as to why and when we order these things. Today we'll talk a little bit about X-rays and ultrasounds, and next time we'll talk a little more about MRIs and CAT scans. But when it comes to any of these investigations, you should be using them to make a diagnosis. You should have an idea in your mind what is going on from your clinical exam, and you want to use them to confirm a diagnosis and not to make a diagnosis, because what can happen is you look at someone's X-ray or someone's MRI and you see something and say, well, that's the problem. And they say, well, that's in my hip, my problem is actually in my back, or it's on the other side is my problem. So you really need to have an idea of what's going on before you order these things to make the diagnosis. So if we're going to talk about X-rays, X-rays uses radiation. So these photons, neutrons, electrons are shot at you. And different tissues will absorb the radiation in different amounts. So if it's hitting metal in you, it's going to be pretty well white. If it's hitting bone, it could be a little bit of white into a little bit of gray. If it's going through water, well, water's not going to absorb much of the radiation, so you might get a little bit of a light gray, maybe. If it's going through air, it's going to be black, because it's not going to absorb anything at all. So depending on what tissue it's hitting, that's what we're looking for. And generally, we'll look at use an X-ray for looking for fractures, misalignments, degeneration, arthritis, things like that. An X-ray itself uses radiation, as I mentioned, and radiation isn't very good for you. It creates free radicals, which is a precursor to cancer. So you only allow so much radiation in your lifetime. So in our office here, some chiropractors may X-ray you when you first go see them, and then they X-ray you when they kind of finish their first treatment plan with you. And they try and compare the two to show you what's going on. Our office here, my policy is unless it's going to change my treatment plan or going to change my diagnosis, I'm not going to waste X-rays on you, because you're only allowed so much in your lifetime, and I don't want to be wasting unless I really need to use it. An X-ray in Ontario, if you want to pay for it privately, would cost you in between $40 for a single finger to get X-rayed, up to maybe $250 or $300 in order to get a low back series done of about 7 different films. The other thing we'll talk a little bit today is an ultrasound. An ultrasound is a sound wave. In the head of the ultrasound is a crystal, and that crystal will vibrate. That vibration sound wave goes into your tissues, and same idea is it hits the tissues and it bounces back. You have a receiver that receives the bounce back. Much like radar facing up into the sky, you can see things that bounce back. And that's kind of what ultrasound is all about. And again, different tissues will rebound the sound wave in different manners. There's no real side effects to an ultrasound. The only other thing you'll find is quite often they'll make you drink lots of water before you go in, because that kind of separates the tissues and gives them a better look at things. But that's the only real thing with an ultrasound. An ultrasound, again, really good for looking at soft tissues. So really good looking at muscles and joint and ligaments, organs, and things like that. So an X-ray is used to look at bones and the hard tissues. An ultrasound is used to look at soft tissues. So you can use the two of them to look at, if you're looking for something for muscles or looking at something for bones. An ultrasound in Ontario will cost you between $100 and $500. So again, it's not that expensive to get these things done. The only problem with both X-rays and ultrasounds is they only really see about 60 to 70% of stuff that's in there. So even by doing that, we still could be missing 30 to 40% of something that is in there, because it's either not bad enough, we don't see it, we don't catch enough. Because with both these things, it's all kind of based on your weight and your height, of how much radiation and how much ultrasound we're doing for you. So if we don't get the factors quite right, we could be missing something. It could the X-ray could come out too white or too dark, or the ultrasound could not go deep enough. So there still could be missing 30 to 40% of what's there. So we look at that first, and if we still are treating you when it's not getting better, then we can talk about what an MRI and a CAT scan could do. I'm Dr. Jeff. If you have any questions about anything we talked about today, you can always email me at jgoldsworthy@goldsworthywellness.com, or you can talk to me on Facebook. I'm Dr. Jeff, and of course, we've got your back.